Hello, 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 ladies, and welcome to the Get Your Guy Coaching Podcast. I have a very special guest, and we're going to get into all the tea and also all the V. We have Dr. Fenwa Milhouse here. She is the urologist, and I had to bring her here because, honey, we gotta explore down there. We gotta talk about what's really happening, and she is the only person that I wanted on this podcast to talk about it. Dr. Fenwa Milhouse, thank you so much for being here, girl.
Thank you. Oh my God. I must tell you, when I got your DM, like, I want you to talk to, I kind of was like fangirling because I follow you. I've been following you for a while. Your
Thank you.
tips, your vibe, everything. I love it. So I was like, he wants me. Oh my God, little
Of
old me.
course. I mean, we own
Love it.
only the best here,
Yeah.
girl. Only the
Yes.
best. And
Yeah.
what I
Thank
love
you.
about what you do is straight no chaser. We're putting it on the
Mhm.
table. We're talking about it. So why don't you introduce yourself? Let the girls know what your tea is, what you're all about.
Yeah. So my name is Fenwa Milhouse. I'm a medical doctor, board certified urologist, and I did a fellowship, so extra years of training, subspecialty in female pelvic medicine, reconstructive surgery. My niche in urology is really about sex and genitals and pelvic floor. Okay. I deal with sexual issues. I deal with genital issues, not just penises, but vaginas and vulvas.
And for those
Um,
ladies that are just listening to audio, she has her own Muppet
oh, yeah, this is
vagina
audio.
here, girl. That she continues to
Yes.
move and talk to me
Like,
as if I've spoken to one girl, and I have not.
yes. I've got my vulva puppet and it's talking to Coach Anwar.
Oh my God, girl, you already on another level. I'm living.
Yeah. And pelvic floor issues. And my practice is based on I own my own practice, which I'm very proud of. I'm probably most proud of that. Very few of us doctors are owning our own practice these days.
Yeah.
And it is based in Chicago, Illinois. It's called Down There Urology. And in my practice, I see all adult individuals, no matter what's between their legs. I do tend to see more vulva and vaginal owners than anything else. And I talk a lot about vaginal health and sex and pelvic floor stuff. And that's what we're here to talk about.
I love that. Now, I'm not
Yeah.
going to put anything past our listeners. Can you just kind of describe the difference between the vagina, the vulva, and the pelvic floor? Because some of us, we've heard of it, we don't know what it is. And so I just want us to learn together in community with no shame.
I agree totally. I mean, no one teaches us these things. I don't think I had ever heard the term vulva until well into medical school, maybe even early residency. But so that everybody's on the same page, technically, what we see on the outside, externally, the female part is the vulva. Okay. We always refer to it as we kind of refer to everything as vagina, but
Right.
the vulva is all the parts that we see. It includes the lips, the opening of the vagina, the opening of the urethra where we pee out of. It includes the clitoris. All of that is the vulva. Okay. The vagina is the inner tube. It's the part where we things go in and out. Okay. That is the part we can't actually see our own vaginas. All right. So if you're pointing down there and you're like, my vagina, you're really the inner part is the vagina. Okay. We can see, the medical doctors can see your vagina with the speculum. All right. So that's the difference. The pelvic floor is a group and collection of paired muscles that envelopes our genitals and wraps around towards and envelopes our anus. And pelvic floor exists in penis owners and vulva owners. Okay. And they're important. The pelvic floor is important for the three P's, as I like to say it: peen, pooping, and pleasure.
I know that's right, girl. Not the
Yeah.
three P's. Well, my pelvic floor is more curious now that we've gotten all of that out of the way. So, talk to me about, I mean, you're dealing with topics many women shy away from, obviously, right? Why do you think conversations about vulva, vaginal health, and pleasure are still so taboo, even in 2025?
You know, vagina owners have to live in, let's say, a
Can I
misogynistic
stop you
world.
right there?
Right?
You continue to
Yeah.
say vagina owners. Talk to me about that.
I'm intentional when I say that
I know, I want to
because
know about it.
it's because not all vagina owners are women.
Uh-huh,
You
okay.
see what I'm saying? And so
Yeah,
if I say women, then I'm excluding vaginal owners that identify as male or
okay.
male.
Okay,
Okay.
okay.
So I'm very intentional.
Yeah.
And so I will be referring to vaginal owners. Now, occasionally I'll say female and male. That's more for like medical biological differentiation. But
Uh-huh.
I want to be very inclusive. I'm very inclusive in my terminology.
And we
So
love that about you. Thank you.
yeah, yeah.
Okay, talk to us
So
about taboos, girl.
yeah, so we live in this misogynistic world, and so first of all, our pleasure has never been discussed or even investigated, and is not been taught to us. We Because our genitals are quote unquote hidden, right? For us to see our vulva, we have to take a mirror and look. Whereas for penis owners to see their genitals, all they gotta do is look down. They have to like push their stomach in a bit. This is right there. So it lends its fact into this is some secret hidden compartment that, has babies, and, is there for a penis's pleasure. And that's it. Okay. A lot of us don't know our anatomy. Okay. A lot of us have never seen our very own genitals.
Mhm.
Okay. Sometimes I'm in the office, I'm like, give the mirror, I'm like, hi, well, introduce yourself. I'm like, yeah, like, here you
So, are
go.
you telling all the listeners they gotta go today and get a mirror
Yes.
and, you know, introduce
Introduce
yourself?
themselves.
Yes.
Correct. Hi. Or if it's been a while, be like, reintroduce, like, oh, it's been a while, baby girl. Where you been? Okay.
No, I can
Yes.
hear half of the ladies already saying, I don't know if I want to do that. That feels nasty. That feels like that's a lot. What would you say to that? Because, even Charlotte in Sex and the City had to have one of those moments, girl. But for those ladies
Yeah.
that are like, I don't know if I want to do that, why do I need to do that?
Well, first of all, you need to stop and ask yourself, why does it feel nasty to you? Like, think about it. What have we been conditioned to believe about ourselves that makes looking at your own body feel nasty? Right? That's crazy to think your own body inherently is nasty to look at, right? It's how we've been conditioned up here,
Yeah.
right? That the female part is kind of gross, and it's not. Okay. So we have to like deconstruct our mind and our mentality about it. And then
Yeah.
the other thing is it's important to know because there might be things down there that are that may be dangerous unbeknownst to you might need to be taken care of, to be addressed. Um, I have had the unfortunate pleasure of diagnosing vulva cancer in individuals that had really not looked, okay, and not seen it. And so it's a good idea, just like, dermatologists, they'll do like a skin exam all over your body. That includes your genitals, okay? It's easy to do. Just grab a mirror, put it on. If you get a big mirror, you can lay it on the floor and then straddle over it, spread those lips and see if there's a new pigmentation or new spots or
Yeah, that's what I was going to
have
ask. What are we looking
changed over it.
for? Yeah. Okay. You said new
Yeah, I mean,
pigmentation spots.
yeah. So I mean, lumps and bumps, right?
Okay.
Looking for things that are protruding. There are some pathologies where things might protrude out of the opening. There are skin changes on the lips and just inside the lips that might be signs of dermatologic conditions that affect the vulva and the vagina. There's a condition called lichen sclerosis that can be quite devastating left untreated, but can be very much treated. And it can start with just losing pigmentation of the labia,
Mhm.
and then manifest into like severe dryness, pain, itching, cracking, of the vulva and the vagina. And so those of us that look may notice some changes that are like, what, this is looking kind of different. And take a look at your clitoris. What does your clitoris look like? Take a look under the hood of the clitoris. Every clitoris has a hood that is covering it, almost like the foreskin of a man's penis, those that are uncircumcised. But this hood you can retract and ideally see the glands of
Mhm.
your clitoris.
Awesome. Okay, good.
Your
So,
face.
well,
Y'all can see
but
his
you
face.
have
It's
you
like,
have the Muppet. You have the
I
puppet.
do have a gauntlet. I
So
know I wish
and
video.
for those that are audio, we'll put this on YouTube. You'll see the visual so that you get a sense. She is real, girl. She put in the hood up, girl. We're at the auto
Yes.
garage. We're at the Volvo garage, girl. Opening that hood.
Yes.
Talk to
Yes.
me about some
Yeah.
common misconceptions, right, that women have about their own anatomy that surprise you.
I mean, I'm no longer that surprised, but believe it or not, adult women may not know that they urinate out of a separate orifice.
Mm.
Okay. that there is something called the urethra that lives in our vulva, which
Mm-hmm.
is where you pee out of. Okay, I'm going to tell you a story, and it's not meant to shame, but I saw an individual in my practice, and she came in saying she's peeing out of a new hole that she never knew existed. She, all her life, was convinced that she peed out of her clitoris. And that just isn't a thing. Okay. And it turned into just a normal anatomy lesson. I was like, this is your anatomy. Again, has never been taught and never looked. And, I pointed out, pointed out the normal anatomy. So your urethra, where you pee out of, sits right above your vagina. It sits literally, it's sweetmates with the opening of your vagina. You put your finger in your vagina and you go right above, there's the urethra. Okay. And so that is one thing. Another thing that is even more pervasively unknown is the fact that the clitoris that we see right here, this nubbin, is not even the entire clitoris. In fact, it's only a small portion of the entire clitoris. Majority of our clitoris lives underneath the tissues. Our clitoris is shaped like a wishbone, okay, and has like two sets of legs that
Mm-hmm.
extend down from the head. Okay, so you have this head, and then you have two sets of legs that extend down. I wore a clitoris necklace for months around. And I would ask random strangers, all walks of life, um, uh, men and women, hey, what do you think this is? And literally 95% of people got it wrong. 95% of people couldn't tell me what it was. Okay. So vast majority of adults have never seen what the actual full clitoris looks like.
Yeah.
And certainly women don't know this either.
Okay. No, girl,
Yeah.
I'm learning too. I love wishbones.
Yeah.
I love Thanksgiving, honey. Let's get it together. Awesome,
Yeah.
awesome, awesome. So following up on
And
that
let me say
point.
one thing.
Yeah.
The other thing is your clitoris. The clitoris is, think of the clitoris like a penis. If you think of the clitoris like a penis, then it all makes more sense. Okay.
What
The
do you mean?
clitoris is our version of a penis. All right.
Okay.
And the penis, the head of the penis is very sensitive, right? Okay. The
Mm-hmm.
head of the clitoris is very sensitive. If you want to get a penis to orgasm, you might focus on the head, right?
Mm-hmm.
If you want to get a vulva owner to orgasm, we don't focus on the head. We are focusing on other parts. Like, why aren't we focusing on the head? This is where how 90% of us orgasm is here.
Let's
So
talk
think
about the
the clitoris is
orgasm
the,
gap because there
yes,
is one, right? And you're a huge proponent of making sure that women are having their pleasure each and every time that they want pleasure. So can you talk a little bit about that? And I know that there are some girls that are still faking it. I know, I'm not a fan of that, but how can we start to kind of narrow that gap, but also advocate for our own pleasure early on in dating, but also in sexual experiences in general?
number one, you have to own your orgasm, I believe. You cannot expect somebody to figure out what it is that gets you off. Okay. You may learn from sexual experiences with others, like, oh my God, that guy did that. And baby, I liked it. Okay. But you have to I am a big proponent of self exploration. Okay. When I see individuals who rarely or never get orgasms, it's a lot of self work. It is a lot of self work. Okay. I give them masturbation homework. I give them sex toy homework. You
Can
need
you give the listeners some masturbation and sex toy homework as
Yes.
well, please, doctor?
Yes. So I truly believe if you don't like sex toys, it's probably just because you have not met a sex toy that you have not met the right sex toy for you. Okay. And everyone is different, right? What might get me off and I love, everybody's crazy about this rose. Not a huge fan of the rose personally, but I love it for those people who love it. But other things may be. So I would explore different toys, different feelings. Maybe you like pressure. Maybe you like vibration. Maybe you like wetness and licking. Maybe you like squeezing. Maybe you don't. Maybe you prefer the focus be on your nipples and not your genitals, and that gets you orgasmic. Okay, um, you you are not going to become addicted or conditioned or numb or whatever to toys. Toys aren't going to ruin you.
I
Okay,
think that's
that
such an
is a
important point to make because I think sometimes there are some women that feel like if I do it too much, I'm never going to find pleasure with another person, and that's not
yes.
necessarily the case. So I'm glad that you're pointing that out. But you talked about a
The
toy.
exact
You talked
opposite.
about
The exact
Rose.
opposite is shown when you do the exact opposite tends to happen. Those who do explore with toys and to do use those are more likely, women are more likely to reach orgasm and to have orgasm than those who do not.
Well, we love to hear that, girl. We love to hear that. Um, you
So
talked
yes,
about the
sorry.
rose as
Yeah.
a popular toy. Do you have any other names that are quite popular that people who maybe don't know the space can look up and see and just as a starting
Yeah.
point to explore?
Yeah. So there are vibrators that just focus on the clitoris. There are vibrators that focus on like the vagina, G spot type area. There are vibrators that do both. There are vibrators that focus on clitoris, vagina, and anus. Okay. There are, and so
Triple
there
favorite.
are, yes, the full Monty baby. Okay. So traditionally, when people think about vibrators, they just think about this like phallic looking thing that, that they
Yeah.
can stick in their vagina, which may work great for some and may not be adequate for others. Like I said, almost 90% of us need clitoral stimulation to get an orgasm. There are C vibrators. I'm a fan of a C vibrator. It looks like a C or like a U that's on its side. And they're dual vibrators. Okay. So they will vibrate or suck or both, typically on the top, and then vibrate on the bottom. And you can put the bottom in your vagina, right? Just in your vagina. And the top one sits right on your clitoris. And you can choose to have suction or vibration on the clitoris while you simultaneously get vibration on that vagina, that upper wall of that vagina, the upper wall. Because remember, I said the clitoris has legs that
Yeah.
are under that upper wall of the vagina tends to be a very sensitive spot too, because it's in contact with the inner part of the clitoris. So, baby, that dual vibrator.
And
Ooh, I
I
can
didn't
barely,
know that they
yeah,
sucked now. Girl, I
they
might
do.
have,
Yeah.
girl, I
Ooh,
might have to look something up now. Hello.
yeah.
Okay.
I'm, the suction is tea. It is tea,
I
baby.
know that's
So,
right. So
yes,
it's like a
they have
C,
vibrators that lick.
it's a C shape or a U shape. Are there
Yeah.
specific brands that you like or there's a lot
Oh
of
my God.
them?
There's tons of brands.
Okay.
I'll tell you the brand that I like. In full disclosure, they paid me, but not, I like them even if they didn't pay me. Like I use them, like I have multiple of their stuff, and I really like them. Bellesa Boutique, they have the C-shaped vibrators that suck or lick
Mm-hmm.
or vibrate, and then the bottom, the clitoris, and then the bottom vibrates, and you can change the intensity of both. Like so they have separate settings.
Yeah.
So if you like, well, I like the feeling of the, if you like the feeling of the vibrator in your vagina, but you don't necessarily want it to vibrate, you don't have to.
Hmm.
But you want the part to suck or vibrate, you can do that. So like you can change it up, you can switch it up. It's very like customizable, if you will.
Yeah.
Um, and those the one that I love is called the Air Vibe. And that is my
Honey,
favorite. And you
Air
can
Vibe
even
sales just went up 200%. Let's go.
yes, I know, right? Yes.
Okay, okay. I want to talk about pH balances because I know that a lot of us might not be as aware that some of the products that we're using might not be so great in terms of pH balance or not, whether it's lubes,
Yeah.
soaps. Can we talk a little bit about that? Because I think that pH balance actually isn't talked about as much as I think we need to talk about it. So I'd love for you to share with the ladies, girl,
Yeah.
what should we be putting down there? What should we be putting down there?
Yeah, so the pH of our vagina is really important. It is it tends to want to be what we call more acidic, which is a good thing. Okay. The pH, we want it to be on the lower end. When the pH gets off, then we can be prone to um vaginal odor, number one. Okay. We can be more prone to vaginal infections like BV or bacterial vaginosis. We can be more prone to urinary tract infections or bladder infections. Okay. And so it can really just wreak havoc on our what we call genital urinary sense area. Things that can throw off our pH balance. Well, our pH balance gets thrown off as we age, especially with estrogen levels declining. And so there is a known there's a known change in pH as women go through perimenopause and beyond. And that increases their risk of all of these infections. And there are things that we can do to help with that. pH can be thrown off by semen. Okay. So semen can throw off your pH. That's why some individuals may notice, gosh, whenever I have sex, especially when he ejaculates in me, then I, have itching and odor and other issues. Okay. So it may be that the pH of your mans is throwing you off. All right. pH can be thrown off by products that we use, like you were saying. All right. Things that, certain cleansers or products that we do can disrupt our pH and actually make us more prone to opportunistic infections. All right. These products are meant to cleanse or make us smell like flowers, but they can, in some cases throw off our pH. So it's really, really important that we are choosy with the products that we use down there. Okay. We want to look for things that are pH balanced. We want to look for things that aren't having too many like strong smells. And that, just are less likely to make our pH get off the acidic and go more towards basic.
Have you
Um,
seen any products just like in your practice that you're like, oh my God, this person's using this and it's like it throws them off? Are there any patterns that you've seen, or is it just really different just based on the body? It's that's hard to like even create those patterns.
So I will say this. I mean, I think over the last 10 years or more, there is a complete market of products for the vulva and the vagina, keeping in mind pH balance. Okay, back in the day, like I'm old enough, like back in the day, these summer's eves and whatnots,
Hmm.
they weren't doing good. They weren't good for us. Okay.
Mm.
But people are, individuals are not really using those products anymore, thankfully. And the products we now have on the market are much more thoughtful
Okay.
and careful. Um, every individual might have individual like preferences, but for the most part, I'm seeing these newer vaginal cleanser products being better suited. Having said that, to be fair, you don't need a fancy cleanser. You really don't. Your
Hmm.
vagina itself is a self-cleaning organ. So to the thought of cleaning out your vagina is actually quite ridiculous. Okay. We don't recommend it.
Hmm.
People might want to clean their vulva. Okay. You could simply let warm water run over your vulva and, cleanse it that way. But if you want a gentle cleanser, I think there are most of the current products out there that you'll see on the shelf or online keep in mind pH balance. So I have not run into a bad actor in a very long time.
Okay, that's good to
Yeah.
know. Now, you had mentioned a little bit earlier about menopause and
Yeah.
premenopausal, and I want to talk a little bit a lot about that because I have a lot of women that are in that era. So I would love for you to share just kind of what that means for one's vulva, vagina, and if there are any differences when it comes to women of color versus other women.
Ooh, wait, this could be its own separate
Well, girl, let's get into it
episode.
at least a little bit, honey, because the girls got to
Yes,
know.
they gotta know. They get to know. You please, listeners, I need you to understand that as we get older, perimenopause is typically in our 40s. Menopause typically happens in 50, 51, and then everything after that is postmenopausal. And so as we get older, starting as early as in our 40s, sometimes late 30s, our vagina and vulva lose estrogen. And what that does is it actually changes how it looks and how it feels and how it functions. Okay. It changes how it looks. The inner labia may shrink. The clitoral hood may get stuck. You may lose pigmentation. Um, it may actually shrivel the opening of the vagina. Okay. How it feels, it feels drier. It may feel itchy. It may feel hot or burning. It may feel raw like sandpaper. How it functions, it loses its ability to lubricate on its own. So you may be aroused in your brain, but nothing's getting wet down there. Okay. It loses the ability um, to expand and to widen. So an aroused well estrogenized vagina actually is looser because we have these things called rugae and we have muscle that expands. And so an aroused vagina widens and actually gets longer, like tremendously longer. Okay. That allows us and prepares us for penetration, right?
Hmm.
And with menopause, perimenopause, that ability to do that and get ready for penetration gets weaker and may go away. And so our vaginas essentially become this like stiff, dry, irritated pipes. And the vulva is this irritated opening. None of that is fun for sex. So 50% of people, of menopausal women, have pain with sex. 50.
Wow.
Okay. We're talking about women as early as 40s. Okay. These are not old people. Okay.
Right.
All right. And not almost 90% of us will have bothersome, noticeable vaginal dryness. Okay. 1 out of 3 of us will get recurrent UTIs because it increases the risk of that, the perimenopause and menopause. Okay. We have all of this havoc that is being wreaked down in our lady parts. And the most important thing to remember is that we don't have to suffer like this. Okay. In my world, perfect world, vaginal estrogen, which is the holy grail to help combat everything I just said, would be preventative care. You are 40. Okay. Fenwa Milhouse, you have entered perimenopause. Just so you know, you are, very likely 90% of people have bothersome symptoms, but you don't have to get that way. We can start you on vaginal estrogen. It's very safe. It doesn't get into your bloodstream. It's not going to increase your risk of breast cancer. It's safe to use if you're a smoker. It's not going to increase your risk of blood clots. It's not going to throw off your periods. It's not going to affect your man. It's all of these things. And it can help preserve your vagina and your vulva. Okay. It can help preserve your WAP. It can help preserve your decrease your risk of infections. Like, sign me up today. Okay. If men had this happen to them, it would be, like my friend says, a vaccine. Okay. If penises had the same thing happen to them, there would be a vaccine. All right. Every man would know, oh, yeah, 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 girl, you got to get this. You got to get your penis estrogen because da, 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 da. Okay. It is very, very setting for me as a physician
I'm
to
sure.
see the disparity that takes place when we talk about men's health and women's health. And then you mentioned something about Black women. That's even a double disparity, right? Okay, there's already a gender disparity, now a race and gender disparity. Black women biologically are more likely to enter into menopause earlier
So the
and to
late
deal with
30s more.
menopause, yes, and to deal with menopause longer.
How
Okay.
much
So
longer?
we are so, like, 3, 4, 5 years longer. Okay. Black and Latina women.
Hmm.
Okay. Um, so we are, more likely to suffer, if you will, have more, but less likely to be offered or to use any form of hormone replacement therapy, or get treated. And probably, as we know with medicine, less likely to be taken seriously. You got a Black woman who's complaining about vaginal problems, and it's, unless it's an STD or AIDS or some other thing, they get swept, they can get easily swept and ignored and under the rug. So it is something that I like am extraordinarily passionate about, as you can tell.
Yeah, I
And
love
I
it.
will die, like, my tombstone will be like, take care of your vagina, use vaginal estrogen, because I just have seen so much suffering, so much.
So for the listeners that are like, damn, I need to get on this estrogen, we just need to go to the doctor and tell them, I need some estrogen and I need it now. Like, what's that process look like, and how can we advocate for our health?
Yeah, great question. Okay, so first of all, vaginal estrogen is not the same as, like, hey, I want HRT for, like, my hot flashes. I say that to mean, honestly, any vulva or vagina can get vaginal estrogen safely. Okay. You don't have to be like, well, I'm not menopausal yet. Can I get it? Technically you can. Now, will you find a physician who is up to date and educated on this, hot or cold? But what you say is, you come in armed with education. You say, listen, I am having, I am, want to I want to improve my vaginal health. You may be having symptoms, or I'm having vaginal dryness, or it kind of hurts when I have sex, or I'm itching. And I know that vaginal estrogen is safe to use. I know that there are very few contraindications, really none. And that it does not need to require, there's no blood test that you need before. Okay. There's no blood test you need to monitor. Okay. You could still be menstruating and get vaginal estrogen. It's even safe in breastfeeding moms, which, by the way, breastfeeding moms have low estrogen. And so they can look like menopausal women. Okay. But anyway, and you just say, hey, I know it's safe. There's been multiple studies to show it's safe. And in fact, there are a coalition of really, and oh wait, before I say that, it's now became an American Urologic Association guideline. So just last month, the American Urologic Association released new guidelines for what we call genital urinary syndrome of menopause, what I just described that just happens, right? That it has a name. It's actually a diagnosis called GSM. And the guidelines talk about the safety of vaginal estrogen and how it should be used and prescribed to help individuals with these symptoms. So now it is an official guideline. Go urologist. I'm so proud of us. And they can say it's a guideline.
Yeah,
Check
I
it out.
love that. Thank you so
Yeah.
much for just sharing that and even sharing some of the
Yeah.
language that people can use when
Yes.
advocating for their own vaginal health. I think this is so important. Um, any final fire advice? What's your top glow up tip for vaginal wellness, Black women's vaginal wellness? We want to know.
Oh, my top one is vaginal estrogen. That is it. That literally is it. My top one is keep that wop in. Vaginal estrogen is your friend. It is the essential oil. You know how we do all this stuff to our face, right? We get all these retinol creams and we have this face routine. We do the sunscreen. We're very whatever. Think about your vagina and your vulva like your face, like you think about your face. You
Mhm.
don't want your face to age. You don't want this to age. Okay. And so you get dedicated to some vaginal estrogen and use it like you take care of it, like you take care of your face, baby.
I know
That's
that's
my glow
right,
up tip.
girl. I know that's
Yep.
right. I think this is a game changer because I'm pretty sure that 90% of the listeners here are not on that, and they need to be.
Yes. Yeah. I
So,
agree.
honey, Dr. Fenwa Milhouse has given you multiple homework assignments. Don't get an F in this class. Get an A.
With the masturbation, vibrators, natural estrogen. Yes. We did it
Girl,
all.
that's it. That's it. Hit it, hit it, hit it. Awesome.
Yes.
Dr. Fenwa Milhouse, thank you so much for being here.
Thank
For people that
you.
want to continue in this education and even in the Chicago area work with you, how can they contact you? What are the socials, websites, all of
Yeah.
that?
So I'm mostly on Instagram at Dr. Milhouse, and that is Milhouse with one L, Milhouse. If you search in Instagram or anywhere, if you just search in Google your favorite urologist, you will find me. I have adopted that term
I know
and
that's
made it
right.
my
You
I'm
are the favorite urologist for your favorite urologist.
yes, exactly. I'm your favorite urologist. Yes.
Yes.
And I'm the people's urologist. That's why I thought to myself, like, I'm the people's urologist. I'm gonna be your favorite urologist. I'm also on YouTube. My practice is called Down There Urology. It's really easy to remember because everybody says Down There Urology. So my YouTube channel is my practice name, Down There Urology. I do a lot of quick but longer than Instagram educational videos, super, super helpful. And then obviously, if you want to be a patient of mine, I am accepting new patients. I see patients in the office in Chicago. Chicago's a great city in the summer, so I highly recommend come see me or virtually if you choose. And that is downthereurology.com.
Awesome, awesome, awesome. Thank you so much for sharing all of this amazing information that I know that most people did not even know about. So I'm just so grateful that you've been here to share this information. So thank you so much for being
Thank
here.
you. Thank you for having me.
Of
I
course.
look forward to part two. We're going to have a part two.
Wait, bro, apparently we got to. Apparently we
Yeah.
got to. Awesome, awesome,
Yes.
awesome. All right, ladies, you heard it here first. You got so much homework to do when it comes to your vulva, but vagina, your pelvic floor, everything, girl. I'm so happy that you're here, that you continue to listen and continue to be educated about the totality of who you are as a woman, because this work is not just about getting a guy. This is about becoming the highest version of yourself and the healthiest version of yourself, physically, emotionally, intellectually, and spiritually. So, with that said, I love you all, and I'll see you on the flip side. Bye bye.